Hi, hello everyone. This is Vamshi Krishna. Welcome to my YouTube channel. Today we will see some of the important questions for upcoming staff nurse recruitment examinations. The first question is, when we call postpartum hemorrhage. So after the delivery, when the mother is having bleeding from the vagina, from the uterus, so it is called postpartum hemorrhage. So in which time we call it as a postpartum hemorrhage? The options are hemorrhage after the 24 hours delivery. So after the 24 hours of delivery is we call postpartum hemorrhage. Option B, hemorrhage during the delivery, hemorrhage within 24 hours of delivery. Option D is the all of the above. The right answer is hemorrhage after the 24 hours of delivery. When the mother is having hemorrhage from the uterus after the 24 hours of delivery, it is called postpartum hemorrhage. The next question is, what is atonicity of the uterus? The options are uterus proportion, option B, involution of uterus, option C, uterus intact, option D, subinvolution. The right answer is subinvolution. Subinvolution in the sense it is the failure of uterus from to the normal structure. So after the delivery of the baby, the uterus will be like this. So after some time, uh, after the some of the days or weeks, the uterus has to go to the normal structure. So it is called involution. When the mother is having the uterus is not going to the normal structure, it is called subinvolution or atonicity of the uterus. The next question is, what are the causes of prolonged labor? Prolonged labor in the sense when the mother is giving birth for the baby, so it is normal for the 1 to 3 hours or 1 to 4 hours. It depends on the gravida of the mother, primi or multigravida. It depends on the primigravida or multigravida mothers. So what are the causes for prolonged labor? The options are failure in the cervical dilatation, option B, non descent of presenting part of the baby, option C, absence of uterine contractions, option D, all of the above. The right answer is all of the above. When the mother having these three conditions, the mother may go to the prolonged labor. The next question is, what are the components of partograph? So what are the main components of partograph? The options are mother information, option B, fetal well-being, option C, labor progress, option D, all of the above. The right answer is all of the above. So in this partograph we can see here mother information, name, gravida, para, hospital number and all the details of the mother. And also we can have the fetal heart rate, cervical dilatation and descent of the head of the baby. So we can get all the information regarding delivery of the mother. So the next question is, what is the action of tocolytic agents? So what is the action of tocolytic agent drugs? The options are increase the uterine contraction, option B, decrease the uterine contraction, option C, increase the blood pressure, option D, decrease the blood pressure. The right answer is decrease the uterine contraction. So when the mother is having recurrent abortions or any abnormality of the holding of baby inside the uterus, so in these conditions we can advise the mother for taking tocolytic agents which decrease the contraction of the uterus. So the next question is most common drugs used in the convulsion. Convulsions in the sense seizures or fits or epilepsy. So we can call it as a different names. So what are the drugs most commonly used in the convulsions? The options are diazepam, phenytoin, phenobarbital, all of the above. The right answer is all of the above. Most commonly we can use in the case of convulsions diazepam, phenytoin and phenobarbital. We can use depends on the severity of the convulsion and each drug can be used after the other drug. So the next question is the right stages of the grieving process. So we can have the grieving process. So what is the normal and proper stages of grieving? The options are option A denial, anger, bargaining, depression, acceptance. Option B denial, bargaining, anger, depression, acceptance. Option C denial, bargaining, depression, acceptance, anger. The right answer is option A. So we can call it as a DAPDA. DAPDA means denial, anger, bargaining, depression, or finally acceptance. So this is the normal stages of grieving process is option A is the right answer. So the next question is how many inches of enema tube insertion into the adult rectum? So we know the purpose of enema. So how many inches of tube we can insert into the adult rectum? The options are 3 to 5 inches, option B 3 to 4 inches, option C 1 to 1.5 inches. The right answer is option B. 3 to 4 inches we can use in the adults and 1 to 1.5 inches we can use in the children's. The next question is what is the mechanism of retention enema? So there are so many types of enema. So among them the one type of enema it is retention enema. So what is the mechanism and what is the purpose of giving for the patient this kind of enema? The options are it lubricates the intestine, option B to administer the medication, option C to improve the motility of the intestine. The right answer is option B to administer the medication into the intestine. We call it as a retention enema. The next question is what is the normal temperature of enema solution for adults? So we can give the enema for the patient. Before giving the enema, what is the normal temperature of enema solution? The option A 105 degree Fahrenheit, option B 108 degree Fahrenheit, option C 98.6 Fahrenheit. The right answer is option A 105 degree Fahrenheit. In this temperature only we can give enema for the patient. The next question is which are the non-observable suture material. So these suture materials we are using for repairing of the injuries or repairing of the wounds. So which are the non-observable suture materials? The options are polypropylene, polyester, polyamide, all of the above. The right answer is all of the above. So these three kinds of suture materials are come under the non-absorbable. Non-absorbable in the sense the sutures cannot be absorbed into the body of the patient. The next question is, which are the most specific cardiac markers? Cardiac markers are the markers which give the specific information of the cardiac condition or heart functioning. So the options are troponin 1, myoglobin, total creatine kinase. So these three are the cardiac markers only. But what is the which is the most specific cardiac marker? The right answer is troponin 1. Troponin 1 is the most specific cardiac marker. The next question is, the nurse doing a physical examination of abdomen. What is the order of examination? The options are option A, inspection, percussion, auscultation, palpation. Option B, inspection, auscultation, percussion, palpation. Option C, inspection, palpation, auscultation, percussion. Sorry, this is spelling mistake. This is percussion. The right answer is option B. Option B is the inspection. Inspection in the sense visualization or seeing the physical structure of the abdomen. Auscultation is hearing of the abdomen sounds. The intestinal sounds which are present in the abdomen we can hear by method of auscultation. Percussion is the deep pressing of the organ to know the structure or edema or fluid or air filling gaps present in the abdomen. The palpation is also same as percussion, but we can palpate the temperature, normal structure of the organs. That is, this is superficial. The percussion is deep organs. So the next question is, most serious complication of bone fracture. So we all know that the most of the patients are having the bone fracture due to the some of the road accidents or falling on the ground. So among the all types of complications, which is the most serious complication of bone fracture? The options are fat metabolism, option B arthritis, option C septicemia. The right answer is fat metabolism. Why the fat metabolism? This is fat embolism. Okay, so why the fat embolism is the most serious complication of bone fracture? So when the large bones are broken, fat from the bone marrow. So in the bone marrow, we have the fat cells or blood cells, okay, all the tissue present in the bone marrow, which is made up of fat cells, seeps into the bloodstream. So when the patient is having the fracture, so the release of fat cells from the bone marrow, it will enter into the blood. So the fat cells which are present in the bloodstream, it can go to the brain or lungs, okay, and a heart. So important organs it can affected by the fat cells, so it can cause fat embolism. So the next question is, the following condition is a vitamin C deficiency. So among these three conditions, which is caused by the vitamin C deficiency? The options are jaundice, option B, scurvy, option C, asthma. The right answer is scurvy. Scurvy is the condition of germ infection. The gums which are present in the between the tooth, we can see the infection, inflammation of the gums, and also skin infection and anemia. So all the conditions can caused by the vitamin C deficiency in the case of scurvy disease. The next question is, what is the proper position of the tip of the central venous catheter? So we all know that we have seen the in many cases of we are gi- we are doing the procedure of central venous catheter. So what is the proper position of the tip? So central line here we have. So where the tip of the central venous line? The options are superior vena cava, jugular vein, option C, coronary vein. The right answer is superior vena cava. So we can see here superior vena cava, that is blue color. So we can see the tip of the central venous catheter. So here we have the cap. We can give the injection, IV fluids, blood transfusion, all the procedures we can do from here. So we have the tip of the central venous catheter at the superior vena cava. The next question is, which of the following factors is the most important for healing of decubitus ulcer? Decubitus ulcer also known as bed sore. Okay, so when the patient is continuously lying on the bed, so the bony areas get infected, become wound, which called as a bed sore. So which is the most following the important factor for healing of the decubitus ulcer? The options are adequate circulatory system, option A, circulatory system adequately, option B, bed rest, option C, balanced nutrition. The right option is option A, adequate circulatory status. When the wound is taking adequate blood collection, so the wound can be healed properly within a time. The next question is, National Mental Health Program was launched in the year of option A 1982, option B 1981, option C 1980, option D 1979. The right option is 1982. So in the year of 1982, the government has launched mental health programs. So the main aim of this program is to give the proper care for the mentally retarded people and also early diagnosis and prevention of the mental disorders. The next question is, the drugs used in the depression. So when the person is having the depression, so which are drugs we can use? The options are option A, imipramine, option B, carbamazepine, option C, fluoxetine, option D, sodium valproate. The right answer is imipramine. So imipramine is a drug of choice for the depression. The last question is, what is the meaning of kleptomania? So most of the movies we can see for comedy purpose, that is Option A, irresistible desire to set a fire. Option B, irresistible desire to steal things. Option C, compulsive hair pulling. The right answer is option B. Option B is the irresistible desire to steal things. So, in this condition, the patients are having uncontrolled feeling of stealing other items or any objects. The person is not a thief, but also the person is having kleptomania. So, in this condition, the patient is urged to steal the things from the others. So, thank you guys for watching my video.